All right, welcome to DC2B Revolution, where we think big to live large. I'm your host, Noah Voles, and today I'm here with one of the founders of Hint.com, Michael Lubin. He has an impressive resume. I don't even know where to start. Over 13 years with Fortune 500 companies, 9 years in the healthcare tech industry, just a wealth of knowledge. Really excited to share what he is doing with what he calls direct primary care and membership-based practices. So, Michael, thanks for being here.
It's my pleasure, Noah. Pleasure to be here with you.
Awesome. So getting into it, you know, what are chiropractic students, what are chiropractors really interested in? For a long time in chiropractic, it's been all about transitioning from an insurance-based model to a cash-based model. But you offer a kind of unique solution. And so how do you help chiropractors who want to create more of a membership model launch, manage, and grow a successful direct care business?
Yeah, so Noah, I'll take a couple steps back and just kind of give you some perspective on where we came from and why we think this model is so transformative for any healthcare provider who delivers care on an enduring basis and wants to build enduring relationships with patients. So we've been around as a company for about 4 years, and we've always been, as people, we've always been attracted in healthcare to models and solutions that could actually really help to transform the healthcare crisis and really fire on the proverbial quadruple aim, right, of patient satisfaction, provider satisfaction, as well as better outcomes at a lower cost. I think that's always the objective, but to be honest with you, there's very few places you can point to in healthcare today that actually delivers on that. What we discovered some time ago, and this is not a new concept, but it's just starting to kind of take off, is really a payment model innovation that moves away from the fee-for-service structure. And I don't care whether that fee-for-service structure is being paid on a cash basis or it's being paid by a third-party insurer. Fee-for-service, we just believe strongly that it's the wrong way to pay for healthcare. When a provider's providing care and services to a patient and wants to maintain a relationship on an enduring basis, because the incentives are upside down, right? It incents the provider to maybe do things that aren't entirely necessary, because the only way you make money is when you do things, and it disincents patients from engaging in care, sticking with care. Because there's a toll they have to pay every time that they want to engage in care. So it breaks down the whole system. So certainly in primary care and chiropractic care as well, where the relationship you want to have deep relationships, you want them to be enduring. The fee-for-service model just gets in the way of that. There's this movement happening in primary care that you referenced called direct primary care, where really the innovation is it's not rocket science, but the innovation is two things. One is it's providers saying, I can't operate in the insurance world anymore. The reimbursement continues to decline, and the administrative work that I need to do in order to continue to play that game and the technology investments that I need is so overburdensome that I'm just losing money. The economic model is broken in primary care. And so it started happening, about 10 years ago, as there was providers that, responded to that and started creating this thing called direct primary care. And it's kind of like concierge medicine, but for the masses. Very attractive price points, a membership-based payment model, so a recurring payment model, and living outside of third-party payers, so a cash model. But the real innovation in a membership model is that when you have a recurring payment model like that, it all of a sudden transforms what you can do with patients. Because you now have a payment model that's paying for your time to be able to provide access in brand new ways, right? And a fee-for-service model, doctors are discouraged from taking emails or taking calls or texting patients, even though the patient wants to be able to communicate with the provider that way, because there's no payment model for it. In a membership model, now you've got a recurring revenue stream, right? That's paying for your time and time consistently that can transform access, which is a huge problem in our healthcare system today. And because it also takes away that concept of a toll every time the patient wants to engage in care. So, primary care physicians, integrative physicians, generally speaking, anybody who has an enduring relationship and really needs for patients to be compliant with plans thrive in a membership model, because now patients can access as much as they want of you to drive deeper relationships and engagement. And they don't feel like they're going to be charged every time they have to do something, hence discouraging them from continuing and executing and following through with your plan that you want them to have. So, and we've seen this model in operation across thousands of practices now. And it's, and not only does it kind of transform the patient-physician relationship, because it deepens it. Because now my patients can access me the way they access their friends and family. They can text me when they need to. They can email when they need to. We may have video chats. So all of a sudden, there's a payment model for remote care, which allows much more interaction, and it deepens the relationship. But it also is driving very significant compliance on care plans, right? I'm sure patients come in, right? They'll come into your practice, the future, Noah, and they may have complicated issues, and you can see a path for them, and you can see a plan. But in order for them to really deliver that, for you to deliver that ultimate outcome, they have to be compliant. In a membership model where they can come in when they need to, they can follow your instructions, come in more if they need to, because you've got a revenue model that supports that. All of a sudden, compliance transforms, and therefore outcome transforms as well. And to have a payment model where patients can actually access the doctor when and where they need to is kind of a dumb and simple concept, but it doesn't happen in today's healthcare. So to have a payment model that allows that also just transform how patients engage in healthcare, their satisfaction with healthcare, and the depth of relationship that they can achieve. Which, and there's plenty of data out there that clearly supports that the deeper the provider-patient relationship, the better the outcome. And so it's a payment model that just allows all those things to just naturally happen, and it's quite transformative.
Yeah, you mentioned a lot about these better outcomes and better compliance, and that makes total sense to me. I can hear some chiropractic students maybe wondering, how does it reduce the cost to the end consumer? And then are the chiropractors or chiropractic students actually making as much as they would make in an insurance or cash-based model that doesn't have a membership program?
Sure. So, obviously, you have to get relatively tactical in building your business plan when you're thinking about building a chiropractic practice, to think about, okay, well, if I want to be membership based, what am I going to include in that membership? What is a patient going to get? Does it include unlimited everything that could be in your office every day for adjustments, or are there some limits there? So I don't think on this discussion we're going to be able to solve for those, but we work a lot with practice to define that membership package that doesn't, that allows the practice to be able to be profitable and make money, allow for the benefits that I described earlier to happen, but it doesn't overburden the provider as well. So it's largely dependent upon the practice you want to design and have, the scope of services that you want to include. But we see a lot where there's kind of a defined scope of services that are included in that membership. And if they want to exceed that, maybe you move to a fee-for-service model after that. We've seen models that everything's all-inclusive, and we've seen that model work very well. We've also seen models where there's a membership fee, but then there might be two payment models in the practice. We've seen this quite a bit too, where there's a membership program, and that membership program costs a certain amount every month or quarter or semi-annually, annually. There's different ways that patients could pay in that regard. But then what it does is it offers the patients access to you in which they would pay your services on a fee-for-service basis, but do so on a deeply, deeply discounted basis. Or just do the traditional fee-for-service model. So there's lots of different ways to kind of package up a membership program. Again, largely dependent upon the kind of practice that you want to have, the scope of services, what your business model is, how you want to position yourself and provide to patients. All of that thinking kind of goes into how you structure your membership plan, but it can take lots of different forms and flavors, so to speak.
Yeah, so I'm hearing that, what you do is really find the kind of membership plan that's going to work best for the business and really help that specific practitioner deliver the type of care that they want to deliver. Because that feels to me like that's the ultimate goal, is like delivering the highest quality care and getting the best possible outcomes. Would you say that's correct? Or
100%. And fee-for-service medicine just gets in the way of that goal. This model helps to absolutely support and accelerate that goal. but the tactical implementation of a membership program in a practice really, quite frankly, will differ to a certain degree from a practice by practice standpoint, depending upon the nature of the practice and the goals of that practice and what it wants to achieve.
Perfect. And so I imagine you've worked with some chiropractors in the past. What's the feedback that you've gotten from chiropractors in terms of the transition to this model and their overall satisfaction, their overall patient satisfaction? Or do most of the chiropractors you've worked with kind of start with this model, right out of the gate?
So most chiropractors that we've worked with, and most chiropractors that we've come in contact with, are offerings are typically coming from a fee-for-service payment structure. God knows there are membership-based chiropractic offices out there, but the norm is fee-for-service. And quite frankly, the norm is fee-for-service across healthcare and across providers, because that's all we knew, right? That's kind of where we've been. Membership models in healthcare are a relatively new concept. Yes, concepts like concierge medicine, right, have been around for a decade or a couple decades, but mainstreaming of this membership model is a relatively new concept. So most chiropractors are transitioning or want to transition to a membership model, and they're oftentimes doing so because really for two reasons. One is I don't have to give them the speech about why a membership payment model, how it can be transformative in the ways and kind of that quadruple aim goal. Right? They're there on that. They see that. They also want to improve their outcomes, and they want to improve patient compliance, and they see this model as a way to do that. And the third thing is that, and not everybody understands this, and we actually educate people on this as well. The third thing is that from a pure business standpoint, a membership-based business that generates recurring revenue, generally speaking, this is a Silicon Valley rule of thumb, right? But it applies to any recurring revenue-based business. 3 to 4 times, it's worth 3 to 4 times its revenue in its value. A fee-for-service business, whether it's a chiropractor or a software company, doesn't matter. A fee-for-service business is out of business the second you don't come to work. So the other power of a membership model, and this is outside the kind of the quadruple aim. The other phenomenal benefit from a pure business owner standpoint is creating an asset, a financial asset that is significantly more valuable than a fee-for-service payment model asset for the reasons that I mentioned. And we certainly have talked to chiropractors that recognize that. Maybe they're chiropractors that have built mature practices and they want to transition or maybe sell in the future, and or maybe bring in a partner. Having a business that just brings in the same amount of revenue or growing amount of revenue, consistently, every month, no matter what, is significantly more value. So you're building a financial asset as you're building your practice. It's kind of a side benefit that that's very, very valuable as well. But again, most chiropractors are coming from a fee-for-service model. They're starting to understand the benefits of a membership model, and then they're working with us to kind of design and implement.
Awesome. And so what is it that you kind of do specifically? The chiropractor is seeing that the membership model is the way to go for them, and they want to kind of implement this. So what are the services that you provide to, beyond that kind of tactical assessment of the perfect membership model for them to help them implement? And then what kind of, support do you give to them long-term as they continue through the model?
Yeah, absolutely. No. So now we're kind of getting to kind of the creation story behind Hint Health, which is our company. We, as I mentioned earlier, we're huge believers in this payment model because we think it's a business model innovation that can really help transform healthcare. We spent, probably a good solid year. This is going back about 4 or 5 years ago before we started Hint, studying dozens and dozens of successful, mature, membership-based healthcare practices. Some chiropractic, many in primary care, but quite frankly, we have cardiologist clients, we have psychiatry clients. Again, think of the commonality as enduring patient relationships, and then membership being a business model and payment model transformation. But we study these practices because we want to understand them from the ground up. We want to understand them economically, operationally, clinically, administratively. Because we knew it was a very different model, but we wanted to understand it from all angles. And there was a couple things that really stood out. Number one, the number one fundamental difference compared to a traditional fee-for-service insurance or cash-based practice model is this concept of access. right? Because now you've got a payment model that's paying for your time, Noah, for your clients to interact with you and reach out to you and communicate and access you in office visits and beyond. So, but what you start to see the shift, and this is one thing that providers are extremely happy with, away from 98% of your patient interactions being office visits to a balance of office visits, 50-50 office visits and remote communication and contact and engagement. That shift all of a sudden opens up brand new requirements for technology and support and different tools that you need. But the one thing that really stood out for us was this whole area, and I'll refer to it as membership plan administration. So everything from, okay, well, I've got a membership program now. How do I enroll people? How do I calculate their pricing? How do I set them up so that I can bill them? How do I recurringly charge them? How do I deal with accounts receivable and credit card charge failing and all that kind of stuff? That whole function, right, was quite frankly very, very difficult to manage. And what's interesting is that I think a lot of providers coming into this model think that, I'm going to stop billing insurance. I'm going to move away from fee for service. I'm going to move into a membership model. And geez, I'm just going to get one of, hundreds of recurring charge, software systems out there. I'll take credit cards and patients and it's all good, right? But the reality is, as we were watching these practices, is that number one, we find it to be very common to have relatively complex pricing structures. So what do I mean by that? We have a lot of our clients may have multiple plans. So they may have a gold, silver, and a bronze plan. And then within those plans, they'll have different pricing structures. For individuals, they may give discounts if couples sign up or if families sign up. They'll offer people the ability to pay monthly, or they can prepay quarterly, semi-annual, or annually. And then they'll offer some discounting around that. And then they'll have special rates for you get the picture. I could go on. That's very common. It's very common to relatively complex pricing structures. So, and prior to Hint, there was nothing out there that was designed to support this particular function of this practice. So everybody cobbled together ways of doing it, right? They, paper enroll people, or maybe have a form on their website. They'd always have a spreadsheet to kind of track their members. They'd get the calculator out and calculate what the discount was for that month for that membership. If a couple is signing up, half the time get that calculation wrong. And then manually set them up in the credit card process, and then manually set them up in their EMR, their clinical system. So that's okay if you're having maybe one new member a month and you have a practice of about 50 people. But for these mature practices, 200, 500, 600, 800,000 patients, it was a disaster. We saw accounts receivable growing. We saw administrative burdens that would just grow linearly with the membership as it grew. And as we looked at that whole workflow, we said, we're pretty confident we can develop a solution that pretty much completely automates that whole function that's designed from the ground up for healthcare and for healthcare providers that are operating this model, that allows doctors to come in and introduce and launch membership-based models, but do so for about the same cost, if not less than just credit card processing fees alone. So we don't really add much cost to the business, but importantly, allow them to grow and scale the management of the administrative management of that membership plan program without any of that admin burden growing. Because in order for your practice to be successful, or anybody's practice to be successful in this model, and they have to be able to operate very leanly, extremely efficiently, and they've got to be dedicating 90 to 95% of their time on clinical care. It can't be 50-50 like a traditional fee-for-service insurance-based practice, because clinical care suffers, patient engagement, everything falls apart. And that's what we saw these practices trending in that direction, because there wasn't a solution that was designed to allow this model to be able to allow a provider to scale it very cost effectively and efficiently. So that was really the insight for Hint. So we developed that solution. We launched it about 3 years ago. We have well over 1,000 clients across the country that are using it, growing very rapidly, because it's the only thing that was purpose-built for healthcare providers like you that want to launch into this space.
Yeah, beautiful. I love how you were really able to hone in on what was going to help those providers offer the highest quality care. I know with all the different chiropractors I've been shadowing, some of them have 4 or 5 employees in their billing department, trying to get through all that administrative. And of course, a lot of these are insurance and cash-based practices, but you've really streamlined that process and made it, like you said, made it a lot leaner for somebody to have a relatively small sustainable practice, or even a huge practice if they want to scale to that size, because you have all the systems in place.
Yeah. I think the other thing to point out relative to what we're doing in the marketplace as well with our technology strategy is we, obviously what you're hearing and learning, is that our solution is relatively narrow in focus, right? But very deep and sophisticated in what we do. I'll refer to it as a best of breed solution. Because in technology broadly, there's really two strategies out there, since the dawn of technology. There's kind of the all-in-one system approach, and I know you're familiar with that world, right? That's kind of where many industries have been for the last 20, 30, 40, 50 years in technology. But what's happening across technology, in technology broadly speaking, in healthcare and beyond, is a movement away from the all-in-one system to a best-of-breed approach. In other words, I'm sure you're familiar, there is an explosion of technologies happening in healthcare, but they tend to be best-of-breed solutions, right? They're designed to do certain things brilliantly well in the clinical workflow or patient engagement area or the administrative workflow or the billing workflow. But like Hint, they're narrowly focused but ingenious in what they're developing and get better at it every day. And the other difference is that's allowing this strategy to foment is the concept of an API, right? In other words, you can design systems today that are very easy to connect to other systems. You just need to do it from the start. And so we built our system. We knew we wanted to be best of breed, despite our clients saying, hey guys, can you just build the EMR part now and just build the patient engagement part now and just build the, we don't believe in that. We want to stay focused in our area so we can continue to optimize there. But what we're doing is that we're building an ecosystem of connected applications, EMR, patient engagement tools, in-house dispense tools, really the tools that are uniquely designed to support the unique requirements of a membership-based practice, so that our clients who always want to use Hint is kind of that core backbone foundational piece that's going to optimize and efficiently manage their business. But be able to literally in the Hint application, click on the EMR they want, click on the patient engagement tool they want, so that they can instantly snap together other best-of-breed tools, have them work seamlessly together, but have choice and flexibility in what they're using, and allow themselves to evolve their tools as they evolve as well. So essentially creating an ecosystem of kind of a best-of-breed ecosystem of solutions that are purpose-built to support the unique needs of this practice.
Yeah, I'm so glad you brought that up, because that was the exact question I had in my mind is, how does the API work? How are you interfacing with all of these other, ecosystems that are being built, or these other applications? And so, since you have been honing in on kind of this one area, what does the future look like? Are you just going to get better at what you're doing, or what does it look like, the system you're offering in 3 to 5 years? More, a larger ecosystem, or what's kind of the long-term vision?
Yeah, no, that's a great question, because it's such a fascinating space to work in, because most of our clients, I would refer to them as really kind of 2.0 healthcare organizations that are, many of which that are, and that what I mean by that, the phenomena there is that many of them are recognizing that the future for healthcare providers is direct contracting. So in other words, disintermediating the third-party payer and contracting increasingly directly with consumers and with businesses. And in direct primary care, for example, companies out there are recognizing that, man, the efficiency and cost effectiveness of, and especially the payment model as well, to be able to, to add to my employee benefit roster, right? Where I can just pay the membership fees and allow access of my, my employees to be able to access you when they need to, and when those needs arise, is a very powerful benefit. So from Hint's perspective, we're actually stunned at the amount of and the level of complexity in just our one little area. We're stunned with it. We never thought there would be this much complexity. But what a lot of what's driving that growing complexity is that we're seeing a marketplace evolve very rapidly of providers that are increasingly going direct. And so for example, our client base today is, yes, it's probably 75, 80%, small independent practices, but the remaining 25% is the emergence of direct care networks. And these are organizations that are pulling together chiropractors, primary care, that are operating on a membership model where their real skill and expertise is bundling that and selling it to large self-funded employers who want this benefit. And they see the economic value, so they see the value of the benefit to their employees, and they see it as a critical and perhaps one of the very few tools in their toolbox to bend the cost curve. for all the reasons stated, right? Because geez, I mean, just within primary care or within there's billions of dollars being spent outside of your specialty, outside of primary care, for example. These are low cost, sites of utilization, right? That are being pushed outside of primary care and chiropractic that don't need to be there, but they're being pushed there because of the fee-for-service model, the challenges on access, and so on and so forth. Companies are getting it, and so where we're being pulled as a company is really increasingly supporting these, I'll call them enterprise entities, right? That are putting together networks of membership-based practices to be able to serve large self-funded employers that want to take advantage of that benefit. So part of where we're going is continuously expanding the competencies in our platform, not to just drive further efficiency for a small practice, but to allow them to access these networks, to be able to quickly build these networks, and then obviously, manage and automate a lot of the complexity that these networks are dealing with, and being able to, contract directly with large employers, have multiple providers in multiple locations, automating that enrollment process, the billing process, and all the complexity there. So we see years, actually, just within our narrow channel of development to continue to support and optimize to be able to accelerate the growth of this particular membership-based model in healthcare for both consumers and both employers. So that's, I think that's probably the main area we see that evolving. We also see our ecosystem of connected, mainly clinical tools, growing, because we have many companies coming to us because we're such a dominant player in this membership-based model. They want to provide their services to them, and they see Hint as the conduit to do that. So we provide benefit to them, really as a sales channel, but just it also increases our value to you, Noah, because now you have more choice, right, and flexibility in the tools that are kind of connected off of your core backbone system, being that membership management platform.
Yeah, so exciting. I mean, just these enterprise networks growing and being able to really, service these huge corporations or these huge businesses that have so many employees, and allow them to give the, like you said, the quadruple model, like allow them to give the best possible outcomes, the best possible care, provide the best service to all their different employees. I mean, it's a win-win for everybody in my mind. It sounds great.
Great.
So I'm sure, students, other chiropractors are going to have more questions about this model, about, how to get involved. This is really compelling. So what's the best way for people to get in touch with you, get in touch with the business, find out more?
Sure. So the best way to contact me and contact our company is just coming to our website, and communicating with us. And that, and that website is just hint.com. HINT.com, www.hint.com. That's the easiest way to find us. And there's, and we are kind of continuously developing. Obviously, we're a software solution, right? That's our business. But we have kind of a whole product solution that surrounds our software that helps support providers, leveraging all the expertise we've developed to have them think through their membership plan. The other thing that's worth noting is that we also just help to develop and are supporting a program through an organization called the Evolution of Medicine that maybe you've heard of.
I love those guys, yeah.
Maybe that's how we connect in the first place, now that I think about it. But they just launched, with our support, an educational program that's specifically designed to help providers develop their membership-based practice. And it's an absolutely top-tier, top-notch program. The content of which we help to contribute with, that's being headed up by a gentleman named Tom Blue, who is absolutely one of the truly one of the deepest subject matter experts and pioneers in membership-based medicine. So I encourage people to reach out to us. We will help those folks depending upon where they are in their membership-based model development, curve, between the evolution of medicine and Hint Health as a solution. There's really a growing portfolio of terrific tools to get smart fast on how to implement this model in your practice.
Yeah, I just want to reiterate that. Definitely check out hint.com. Definitely check out the Evolution of Medicine and their membership-based model, and learn more so that, as healthcare evolves, chiropractors can evolve with it. So this has been a production of DC2B Revolution, where I think big to live large. So thankful for your time today, Michael Lubin. Thanks for being here.
My pleasure. No, it's always great to talk to you.
Yeah, likewise. And hopefully I'll see you again soon.